Hi everyone, my name is Farron Smith, and I will be reviewing the use of medical marijuana for cancer patients. This debate video is for Human Issues and Dilemma for Vincennes University. We'll be discussing the use of medical marijuana for cancer patients. Every day there is new technology being invented, new cures being found, and new medications being utilized. There are constant changes and advances being made, one of them being for cancer and its effects. Cancer is a disease in which abnormal cells divide uncontrollably and destroys tissue. It is very unpredictable and it can be spread throughout the body undetected. Sometimes it's not found until the later stages when it's doing its most harm. Cancer causes pain by growing tumors that press against bones, nerves, and organs. Sometimes the pain is caused by the treatment itself from radiation or chemo. There are several ways to try to manage pain in cancer patients. The first normally being pain medications. So controlled substances are drugs or chemicals whose manufacture or possession is regulated by the government, such as illicit drugs and prescription medications. There are 7 classifications of medications. There's CNS depressants, CNS stimulants, hallucinants, dissociative anesthetics, narcotic analgesics, inhalants, and cannabis. The most common medication used to control pain are things such as codeine, fentanyl, hydrocodone or Norco, hydromorphone, methadone, and morphine. However, recently in 47 out of 50 states, it's legal to prescribe marijuana for cancer pain. Research suggests that marijuana can provide relief. Marijuana can be smoked, inhaled, eaten, such as in baked goods. There are even man-made versions of marijuana compounds that are also available by prescriptions. Within the medical field, there is a plethora for options of medications and treatments. Pain is subjective. That means that each person knows their pain limit and how things affect their pain. There are liquid medication, tablets, IV medications, there's a plethora of options. Medications like morphine are derived from synthetic analogs that mimic the body's own analgesic system, and they are the strongest and most effective painkillers currently available. They work in the central nervous system by binding to opioids to the nerve receptors, which blocks the experience of pain. However, the most difficult issue with opioids are overdoses. One of the severe side effects of opioids is the ability to reduce the sensitivity of the respiratory system. So this causes respiratory depression, basically where you don't have the urge to breathe, causing overdose. Narcan is the reversal medication given when respiratory depression is present. The drug choices today are given as part of a treatment plan and helps to reduce pain and side effects of cancer, as well as with the cancer treatment itself. The American Cancer Society has made several statements about the effectiveness of using cannabis as a pain management method. They have said, cannabinoids contain the active ingredient in marijuana. These drugs may be used to treat nausea and vomiting from chemo when the usual antiemetic drugs don't work. They also may be used to stimulate appetite. A younger patient and those who have used marijuana in the past seem to tolerate the side effects better. Marijuana binds to the nerve receptors to block the feeling of pain. The American Lung Cancer Association says marijuana can work similarly to opioids when treating individuals with cancer pain. Additionally, it may have anti-inflammatory effects that can help pain. Some treatment options may include both opioids and marijuana. So there have been some studies done, and they have shown the benefits and the disadvantages of using marijuana. One study took place in Germany. Winfried Hauser and cannabinoids in pain management and palliative care, provides information about marijuana itself and the differences in types, kinds, and includes a study on cannabinoids. The study was a randomized controlled trial that studied the use of cannabinoids in the pain management and palliative care. The patients included chronic cancer and non-chronic cancer patients and the symptomatic treatment of further somatic symptoms. The study concluded that the mean pain intensity at the end of the treatment or change in pain intensity at the end of the treatment versus the baseline showed at least a 30% pain relief use. It was also determined that the use of cannabinoids in pain management should be based on individual therapies. However, on the opposite side of things, there is also gone to show that the side effects can cause tachycardia, hypertension, nausea, vomiting, emotional behaviors such as like paranoia, irritability, agitation, and perceptual symptoms such as hallucinations. There are other side effects such as dry mouth, double vision, urinary retention, decreased heart rate, but these are just mild side effects considering dying from cancer. Utilizing marijuana can be done in several ways to avoid the side effects. The advantages of marijuana are increase of appetite, decrease in anxiety and depression, as well as slowing cancer cell formation, and that's very significant to the patients. Whenever we come down to cancer and the way that they make you feel, these side effects are just minor compared to the quality of life. I have found personal interviews from Dixie Ramongo with her experience on marijuana. She said marijuana was the only thing that kept her from giving up entirely. All she knows is it works for her. It keeps her alive so she can enjoy her grandchildren and her quality of life. She said sometimes the pain was so unbearable that she just wanted to kill herself. Another person was Oliphant he had prostate cancer, and after his cancer, he was left with severe colitis and cystitis, which was caused by the radiation therapy. He said that marijuana helped dull the pain and numb it off. Now, my personal experience that I will be sharing is someone in my family who had cancer and used marijuana themselves. So in 2018, my great-aunt Teresa Pierce of Columbia, Missouri, went to her primary care physician. She started having earaches in her left ear. She had a history of them since a child, and she had a pinhole perforation in her eardrum, which caused her to be deaf in that ear. In December, she started taking her first antibiotics, then her second, and then her physician sent her an ENT with a third round of antibiotics. On January 29th of 2019, Teresa had her first surgery. They found a large tumor on her inner eardrum facing her brain. She was diagnosed with a squamous cell carcinoma on her inner ear, with less than 2% of the population being diagnosed with this type of cancer. Teresa was the fourth person in the United States with this diagnosis. She proceeded with radiation and chemo, and until February, at her follow-up appointment, they determined the cancer was no longer curative and only terminal. As her cancer progressed, her side effects got worse. She started developing nausea and vomiting and uncontrolled pain. This is when her family started suggesting to use marijuana. Teresa's daughter Haley said she didn't want to use it at first. Her mother was very reluctant to use it, but once she did, the pain was almost immediately gone. Her nausea went away, and you could see the pain relief in her face. Teresa told her daughter that the pain would go from an uncontrolled 8 to a controlled 5 or 6 on the pain scale from 1 to 10. Teresa started at first smoking marijuana until she was unable to smoke, and she started using gummies. Teresa's untreated cancer began to eat through her skull, leaving her brain exposed. The marijuana helped her anxiety with the wound as well. However, her health quickly declined, and unfortunately she passed away in November of 2019. There are many ways to treat the effects of cancer by pain management. The effects of cancer include pain from the tumors pushing against bones, tumors, and organs, as well as pain from the chemical release in the body's reaction. There are options of how to treat pain management of cancer. They include pain analgesics, including opioids. However, medical marijuana, the THC, also mimics the body's cells to bind to the receptors to block the pain. Opioids have a high risk of causing respiratory depression, which can lead to death, whereas marijuana only causes things such as dry mouth and tachycardia. With the upcoming popularity of the use of medical marijuana, there are studies being conducted to find out the effects it has on people. These personal studies of Dixie Romano, Oliphant Yu, and Teresa Pierce have shown its unique way to express how marijuana has helped with their cancer. And I believe that marijuana is a beneficial and effective way to treat pain for cancer patients.